Hi, my name is Madison Shaughnessy, and this is my horse Nora and my handler Brittany. And today in this video I'm going to be talking about your horse's overall health and how to check that, including vital signs and being able to recognize any abnormalities in your horse. It's important to know what's normal for your own personal horse because just like humans, horses may run a higher temperature or a lower temperature or a quicker or slower heart rate, etc. So it's important to know what's normal for your horse in case there's a circumstance where something was wrong with your horse and you need to call your vet. It can save the vet time if you've already taken all of your vitals, and it can be very helpful in terms of figuring out what's wrong with your horse. The first thing I'm going to check is the mucous membranes, and you can check this in the conjunctiva of the eye or on the horse's gums. What's normal for the horse would be pink and moist. If the horse's gums or the conjunctiva of the eye are pale and tacky, this could be an indication of dehydration, or the horse could be a little bit shocky. If the horse's gums are a fiery red, that could be an indication of infection or fever. If the gums are a brick red, that could be an indication of poor circulation or blood flow to the extremities. And if the gums are a yellow tint, that could be an indication of liver problems or jaundice. If the gums are a blue color, that could be an indication of cyanosis, which means the horse is not breathing well and not getting enough oxygen. I'm going to check on the gums. I'm just going to let my horse know that I'm here and lift the lip and just kind of take a peek at the gums there. And you want to be careful when you're checking this. If you're under fluorescent lights like this, it can kind of make it tricky. They can make them look kind of abnormally pale, so it's best to do it out in natural light. The next thing I'm going to check is the capillary refill time, and I'm also going to be doing this in the mouth of the horse on the gums. What I'm going to do is, with my left hand here, let my horse know that I'm here, lift her gums, and I'm going to press on her gums for about 2 seconds and release. And it's going to be white where I leave that thumbprint, and you want the color to return back to normal in 1 second or less. And if it takes longer than that, that could be an indication of poor circulation or shock, or even dehydration. Also, whenever you're putting your hands in the horse's mouth, it's best to be on the side. You don't want to be directly in front of your horse. Some horses might not like you sticking your hand in their mouth and they'll swing their head up. So you just want to be safe and make sure you're out of the horse's line of fire if he decided to throw his head. And also be smart about where you're putting your hands in your horse's mouth. You don't want to get bit. The next thing I'm going to check is the horse's hydration level, and by doing that, I'm going to do the skin pinch test. And what you do essentially is pinch the skin, and you want to do it here in this triangle area. And with the loose skin, you just want to grab, pinch, and release. And you want the skin to fall flat, again, in 2 seconds or less. If the skin stays tinted or raised, that can be an indication of dehydration. Also, you want to keep into consideration your horse's age, because as horses get older, they lose elasticity in their skin and it can tend to stand up a little bit longer. So make sure you know the age of your horse and what's normal for your horse in terms of hydration and how they react to the skin pinch test. The next thing I'm going to check is my horse's pulse rate, and there's 3 locations you can do this. The first is right here under the external maxillary artery, just beneath the jawbone here. You can also take it behind the knee on the radial artery. And you can also take the pulse down here, which would be the digital pulse, but for your best reading, you would want to do it here on the maxillary artery. And whenever you feel for this, you can kind of feel a little cord-like structure, and you can kind of roll it on the bone there. That's the maxillary artery, and so what you want to do is you kind of want to press down and wait and feel for the pulse. It'll be slower than you expect because the horses are much bigger than humans, and we expect it to be quicker, but it's not. And when I find the pulse rate, instead of waiting here for 1 minute, a lot of horses don't want to stand still for that long. So what I'm going to do is I'm going to have Brittany here time me for 10 seconds, and then within those 10 seconds I'm going to count how many beats I feel and then multiply that by 6, and that will give me my beats per minute. So I'm going to kind of feel here and get the pulse.
Go.
I counted 6, so 6 times 6 would be 36, so she would have 36 beats per minute, and that does fall within the normal range of 32 to 44 beats per minute. So she's pretty relaxed, and that would be a normal heart rate for her. When you're checking your horse's pulse, you want to take into consideration what kind of activity your horse was in. Maybe your horse you brought in from the pasture might have been running around or had been walking, came from work, and that would cause the heart rate to be elevated. Or if a horse is standing still and the heart rate is elevated, that could be an indication of pain or stress, or something is stressing out your horse, and you want to investigate that more and see why your horse's heart rate is so elevated. Like I mentioned earlier, down here is the digital pulse. This can be taken, but it is harder to feel unless the horse has some type of injury to the foot, is foundering, laminitis, anything like that. Typically you don't want to feel a digital pulse on a healthy, sound horse, but every horse is different. You may be able to feel a little bit of a pulse, or none at all. It just depends on the horse. So you would feel right here on the pasture, right below the fetlock, you would feel a digital pulse. And with her, I don't feel much of anything, but say if she was foundering or had some type of injury, it would be a bounding pulse, and that's definitely an indication of a problem if the pulse is bounding. The next thing I'm going to take is my horse's heart rate, and to do this you are going to need a stethoscope so you can listen to the heart rate, and you will want to place the stethoscope right on the wall of the heart girth here, and you want to do it on the left side. You'll get a better reading, you'll be able to hear it because the heart is on the left side of the horse. And whenever you take this, it's just the same as taking the pulse. You have your handler, or if you have a phone or a timer yourself, you can time yourself for 10 seconds and count how many beats that you hear and multiply that number by 6, and you'll get your heart rate per minute. So what I'm going to do is put my stethoscope here. And this can be sometimes difficult to hear. It, again, is a lot slower than you expect. So I'm just going to try and listen here. And sometimes you might need to move it around a little bit to try and get a better reading. I mean, if you just sit here and hold it in the same spot and you never hear it, you're not helping yourself out. You need to maybe move it around and see if you can hear it better. Go. Stop. And for that, I did get 6 again, so that's consistent with her pulse rate of 36 beats per minute, which falls within the normal range. And also when you're doing this, you want to make sure that you're watching your horse's body language, make sure that they're okay with you being back here. And I placed my hand up on her back just to kind of let her know that I was here while I was listening for her heart rate. So, taking into consideration your horse's activity level and comfort level, you want the horse to fall within a 32 to 44 beats per minute. The next thing I'm going to talk about is respiration rate. And respiration rate is best taken by watching your horse's flanks. And to do this, you want to let your horse know that you're here and really keep an eye on the flanks and be able to recognize when they inhale and exhale. Again, their breath rate is typically a lot slower if they're just standing and if they're relaxed. Activity, stress, anything like that can affect the breathing rate, can make it elevated if the horse has been working or if something is bothering them. So what I'm going to do is watch the flank and count how many times it rises and falls in a 10-second time period, and I'm going to have Brittany again time me, and I'm going to multiply that number by 6, and that will be the breaths per minute. Go. Stop. I got 12. She took 2 breaths, so 6 times 2 is 12, so 12 breaths per minute. And that does fall within the range of 8 to 16 breaths per minute, which would be normal for a horse that is standing and is content. The next thing I'm going to check on Nora here is her gut sounds. And there are 4 quadrants that you want to check and listen for these gut sounds: the upper quadrants and the lower quadrants. And to do this, you can lay your ear on your horse and listen in either 4 quadrants, but I personally like to use a stethoscope because sometimes I can hear better, and it can be a little bit safer. It can be a safer option if your horse isn't okay with you resting your head so close to a sensitive area such as their flanks. Whenever you're listening to their gut sounds, you want to make sure you check all 4 quadrants, because if one has normal gurgling noises, another couldn't, and that could be an indication of colic if there is no sound in the gut. If you hear a rushing, kind of watering sound in the gut, that can be an indication of a hypermodal colic, and that would not be good. So I'm going to go ahead and check Nora's here. I'm going to see how she is with me being back here. And the upper quadrant is kind of right up here. It's the swirl of their hip. I'm just going to listen. And the lower quadrant would be down here, kind of closer to their flank. And I'm definitely hearing constant gut sounds in both of these coordinates here. So that's normal. Everything's functioning and working well. So I'm going to go to the other side and check. Again, make sure she's okay with me being back here. And again, I hear sounds, and she's actually more active on this side than she is on the left. So, but it's still normal. Normal for her, everything's functioning and working well. The last thing I'm going to check is my horse's temperature. And this can be taken with a digital thermometer or a mercury thermometer. And the first one I'm going to do is the digital thermometer. And whenever you are inserting this into the horse, it's good to use petroleum jelly or something that can lubricate it so it's a little bit more comfortable, because not a lot of horses are okay with this. So what you want to do is get a little bit of petroleum jelly and put it on the tip of the thermometer here. You want to go ahead and turn it on and let your horse know that you're back here. You want to kind of pull her tail to the side and insert into the rectum, and it's best to hold it flat against the side of the rectum to get a more accurate reading. And for the digital thermometer, you just wait for it to beep. And she reads in 99.6, and the normal range is 99.5 to 101.5. So she's a little bit lower, but it's still within the normal range for horses. And when you're done with that, you just want to use a towel to kind of clean it off. This can also be done with a mercury thermometer. And before you do anything with this, you want to kind of shake it and make sure that it falls below 98 degrees. It can be a little bit more difficult to read, so it's good to practice working with these to make sure you know how to use them and get an accurate reading. And so you do essentially the same thing whenever you take the temperature. You want to get your petroleum jelly, put it on the tip here. This has a little string and a clip attached. This is used to clip onto the tail if you needed to insert the thermometer and then kind of step away for a minute. This keeps the thermometer from going completely inside of the horse's rectum. So you want to find a good chunk of hair, kind of clip it to here. And the reason we have this, if you step away, you leave this in longer than you would a digital thermometer. You want to leave it in for 2 minutes. So I like to hold it here because I just get a little bit nervous about just leaving it. So I'm going to leave it for 2 minutes and get the reading. Now that it's been in for 2 minutes, I was able to take it out. You want to wipe off the gunk with your towel so you can accurately read it. And it looks to be about 99.5, 100. So that's fairly close to what the digital thermometer read as well. It's good to take your horse's temperature multiple times to get a more accurate reading. Sometimes the digital thermometers can be kind of funky, and these can also be difficult to read. So it's best to do it more than once. A high temperature can be an indication of an infection in the horse's body somewhere, so the horse can have a fever, and it can also be from a horse standing outside in the sun, especially on a hot summer day, or maybe if a horse was just being exercised, that can also elevate the horse's temperature. This concludes my video of a horse's health check, and again, it's important to recognize any differences in your horse's overall appearance and maybe recognize a problem. Say if your horse is in its stall, it's a nice cool day, and the horse is standing still and sweating. If the horse isn't eating and it's feeding time, if the horse isn't excited, if the horse is pointing foot, etc. There can be a lot of different things that can kind of cause for concern if your horse is showing you, and you need to further investigate it, and you can do this by doing your overall horse health check. And again, it's good to take all of your vital signs and check everything over thoroughly before you call your vet, and that can really help the vet out and kind of give him some insight before he comes out to see your horse. Thank you to my handler Brittany and my horse Nora for being so patient with us, and thanks for watching.